Under the RadNet umbrella, prostate imaging is one of our most important men's health initiatives. We have an exclusive team of prostate-dedicated radiologists that read thousands of images from all around the globe. These radiologists are utilizing advanced technologies such as prostate MRI, which offers some of the most detailed visual representations of the prostate gland. When it comes to men's health issues, listen to your body and take a proactive approach. Talk to your doctor, begin screening, and take charge of your health.
Welcome back. Well, today I am joined by Dr. Robert Prinsenthal, who is here on behalf of RadNet. Well, welcome, Dr. Prinsenthal. It's been a while.
Thank you. Good to see you again, Lisa.
Good to see you. And, you guys are on the forefront of all the prostate cancer that's going on and all the treatments. And I thank you for being here to discuss more. Since we've last talked, it seems like there's been a lot of new information.
There has, certainly. Well, this week, the AUA meeting is going on, which is the American Urologic Association. And what I think has really changed is the wider acceptance of urologists to recommend and recognize how prostate MR can really help men who are at risk for prostate cancer. Okay. As we discussed before, the prior method of cancer detection was to get an elevated PSA and a blind biopsy without image guidance. But now with prostate MRI, we can actually see tumors, and we can therefore recommend a targeted biopsy with greater accuracy. But more importantly, we can suggest that a man may not need a biopsy if the MR looks totally benign. So I think the men are getting the word that they shouldn't be afraid about getting screened for prostate health, and urologists are quickly recognizing a valuable role that radiologists can now play.
That is great news. And, it is amazing. Technology is moving so fast. And, we welcome it for sure, because the quicker we can catch things, the better off a person is.
And, men need to realize that prostate cancer and breast cancer are really two sides of the same coin. The statistics show that roughly 225,000 men and 225,000 women will be diagnosed each year of their respective diseases. And even with improved early detection, roughly 28,000 men and women unfortunately die of their respective diseases. So what we're trying to do is to raise awareness for men that prostate cancer doesn't have to be a death sentence. And now we have a lot more different treatment options to reduce the side effects of prostate cancer treatment.
At what point? I mean, most men, I think we've talked about this before, they don't like to go to the doctor. But when they do go to the doctor, is there something that they should be asking their doctor for, or is it a routine part of their exam?
Well, if the urologist is saying your PSA is elevated and I may want to do a biopsy, I think it's important for the patient then to be proactive and say, I heard that imaging may be useful to either tell you where to put the needle, or in fact, I may not need a biopsy, and to have a shared decision discussion with their urologist about the role of imaging. And then of course, there's also improved genomics, or what we call the liquid biopsy. And that would be a urine test called the exosome DX, or a 4K score, or things like that, that can help triage men at risk to again, figure out who would best benefit from this procedure.
Got it. Okay, great. Now there's a couple of companies that you guys are working with that are bringing in artificial intelligence. How is that working with some of the testing, or is it more of the operational side?
It's really the operational side, but I'm so proud to be part of RadNet. They had the vision and acquired a Dutch company called Quantib, and it's now merged and rolled into RadNet. Has a whole separate arm for artificial intelligence called Deep Health out of Boston. Mm-hmm. So the FDA has just approved the new 2.0 software release for Quantib, which really expands its role and allows us to be much more efficient in how we perform and interpret the prostate MR. But more importantly, it helps us become a little bit more accurate by having artificial intelligence point out heat maps of areas of interest to make sure that we see all the areas.
Wow, that's amazing. I mean, it's crazy how, like we said already, how fast technology is moving and all this new stuff. That's awesome. Now, the Tulsa we had talked about before, has anything changed with that?
Yes, Tulsa has improved their technology. And for people who don't know what Tulsa stands for, it's not the city in Oklahoma. Tulsa stands for Transurethral Ablation of prostate tissue using high intensity focused ultrasound. So what makes this technique unique is that we can image the gland under real-time heat mapping, and we in effect cook the tissue from the inside out. And we have incredible real-time control with the MR. And we do this as a team with an anesthesiologist, a urologist, and the radiologist. And we can treat the whole gland, and we can avoid damage of the neurovascular bundles, and we can avoid damage the urinary sphincter, so that when men recover from this, there should be no loss of bladder control, and they should be able to maintain their baseline erectile function.
Yeah, that's great. That is awesome. And you know, that should be a nice comfort to most people who have had the diagnosis that these types of choices are there for them. So, and to have the kind of recovery that you're talking about is great.
But I think it's important to talk about inclusion criteria. Tulsa is not for every man. For some men, we find a low-grade small volume prostate cancer called Gleason score 6 or grade group 1. Most people now even want to take away that stigma of calling it prostate cancer. And for those men, we can just treat with watchful waiting or active surveillance. But if men have a larger volume or more aggressive disease, what we call grade group 2, 3, or 4, and their prostate is the right size and there's no calcifications within it, they may be a candidate for treatment with Tulsa. And the advantage is this is an outpatient procedure. They come in the morning, they're home 4 hours later, and the only thing they have is a draining catheter for 10 to 14 days. But that's it. There's no pain medicine. And the long-term and intermediate data suggests that we maintain excellent oncological control comparable to the outcomes with surgery and radiation therapy.
So you mentioned, you know, men and women both have their respective diseases. So for women, you know, we go and we have a yearly exam and our breasts are checked, and we also do self-check. So what is it a man should do?
Well, the usual preventative recommendations, which are easy to say and hard to follow, and that's to maintain a healthy lifestyle, to have a low-fat diet, the Mediterranean diet, to have regular exercise, to know what your family risk factors are. You can't change your genes and your you know, where you came from, but if you are aware that you're at increased risk, then we recommend earlier screening. And just like with women with breast cancer, some breast cancers don't show up on mammography, but you can feel a lump. So we still recommend that patients undergo a digital rectal exam by their urologist, because a small number of prostate cancers really don't overexpress PSA. So if you get your yearly PSA screening, starting at 50 for normal risk patients, 45 for men at higher risk, take advantage of the genomic liquid biopsy scores and prostate MR. Should you develop cancer, which 1 in 8 men will do eventually sometime in their lifetime, that we can find it when it's contained to the gland and it's easily treatable, and that there's no adverse outcome on their long-term survival.
Now, you mentioned the PSA test. Is that something that they need to ask the doctor for?
Usually, years ago, the United States Preventative Task Force guidelines thought that PSA screening wasn't cost effective, and they didn't recommend that men get a PSA. So it created a lot of controversy and confusion. But now with the role of MR, PSA, when used accurately, can really help save lives, and it really is a cost-effective screening tool. So if the doctor doesn't suggest it, all men at the age of 50 should say, I want a PSA.
Perfect. Well, that's what I wanted to make sure you said, because I think a lot of folks may forget that's something they need to do. And, you know, sometimes, like I said before, you try to get the men to go to the doctor, and it's like pulling teeth.
It is. Nobody wants to do it, but everybody needs to.
Absolutely. Absolutely. Well, thank you so much for the information. I appreciate it.
Thank you for getting the word out as always. Thank you again.
You're welcome. And if you want more information about what we've just discussed, you can always go to prostate.radnet.com. We'll be right back.